Then Dr. Finzi sucks out the numbing fluid along with the fat.
Doing great, Jeannie.
Thank you. You know, you can feel you're doing it. Just, you know, kind of like a scraping, like the doctor would scrape your teeth or the dentist would scrape your teeth, but there's no pain to it whatsoever.
Okay. All done, Jeannie.
The result? 2 liters of fat and a new awareness of the realities of cosmetic surgery. 4 weeks ago, Jeannie Scott had liposuction on her stomach. It will actually be another 5 months before the swelling disappears completely. Not exactly the quick fix so many are hoping for.
Now, I still have some work to do. I need to tighten up my arms. I need to tighten up my legs. But, you know, I've got a goal that I can see starting to happen now because of the surgery. And I think it's going to be easier for me.
Now, most everyone has heard about Botox by now, I'm sure. It's the injection that so many count on to erase lines and take time off your face. Well, now a local doctor says it might also be a treatment for depression. Medical reporter Kathy Fowler joins us now with a look at that story. Kathy?
Well, Leon, some people think if you look better, then you feel better. But this dermatologist says it goes much deeper than that. The real theory of why this might work actually goes back hundreds of years.
I was told that I was clinically depressed.
Kathleen Delano has been suffering on and off from depression for 20 years. She's tried every single antidepressant on the market.
For some reason, for me, I didn't notice any improvement.
She finally gave up on all medicine until one day she noticed a sign at her dermatologist's office recruiting patients for a study on the effects of Botox on depression.
I didn't see the connection, and then I thought, well, this is really different and really interesting, but I'm game. So I tried it.
Working in the hospital and seeing some profoundly depressed psychiatry patients, and they had the biggest frown that I can ever remember.
Dr. Eric Finzi is a dermatologist and a biochemist. He believes there's some kind of connection between the brain and the facial muscles. He thinks by interrupting that connection, using Botox to prevent a person's ability to frown might also prevent the ability to be depressed.
If you project a sort of a happier image, you actually feel better. Darwin wrote about it back in the 1870s.
But Darwin didn't have Botox. Dr. Eric Finzi recruited 10 patients who were diagnosed by psychologist Erica Wasserman as clinically depressed. None of the patients had ever had Botox. Dr. Finzi treated just the main muscles that control a frown. Months later, Dr. Wasserman evaluated them again.
It was really amazing. These people were just experiencing positive improvements in so many aspects of their life. It was really amazing to see.
In this study that's been published in the journal Dermatologic Surgery, 9 of the 10 patients were no longer diagnosed with clinical depression, including Kathleen.
I'm not depressed. I have my days, but I'm not depressed. I would not consider myself a depressed person. I'm a happy person.
Now, we contacted other mental health experts in the field about this study. They said they thought it was interesting, but stressed there needs to be more larger studies to see if it was really the Botox that made the patients feel better or if it was just a placebo effect. Now, if you are suffering from depression, you should see a doctor or a therapist.
Well, the quest to look younger has come a long way in the past few years. These days, Botox is just one way to try and look young.
Both Botox need injections about every 4 months, and parts of your face can look frozen. Well, now there's another method that claims to get rid of wrinkles, and promoters say it is painless and will last for years.
Sounds too good to be true. Fox 5's Karen Myers joins us live once again from the Grooming Lounge in Northwest with more. Karen.
You know, Michael and Lark, it does sound a little too good to be true, but technology certainly is amazing. This procedure is called thermage. It's a facelift without the surgery. Now, it's been around for about 2 years, but the results have been mixed. A Maryland doctor has improved upon it. His technique is called MPAID. Now, you are in and out of the office like that, and there's no need to hide for a month to heal. Sally West wants to knock a few years off her appearance. A little nip and tuck around the eyes, chin, and mouth.
I think it'll just make me feel more refreshed, and I won't look tired and that sort of thing.
She didn't have enough nerve for surgery, and found out with MPAVE she doesn't have to.
I would call this natural cosmetic surgery, all right, because it's just making you look like a younger looking version of you.
Chevy Chase dermasurgeon Dr. Eric Finzi took Thermage, which treats sagging skin using radio frequency, one step further. Using a grid, MPAVE targets the same areas but makes several passes.
You can get a much more significant improvement if you go over an area several times, 4 or 5 times in the same area is going to make a bigger difference than if you just do it one time.
There's no cutting, no blood, and no pain.
The brilliant part that they came up with is that you cool the top of the skin at the same time the heat goes below. When I'm talking heat, I'm not talking so much heat that she winds up getting a bruise. It's just a little bit warmer than her skin is used to. And what that does is stimulates her skin to say, I need to make some new collagen. I need to sort of freshen up my skin.
The comfort it's perfectly comfortable.
Here are some before and after shots with other patients. Thermage worked on 1 out of 2 people. Clinical studies on MPAVE show a 96% success rate.
Excellent.
In 15 minutes, Sally's eyes are done, and there's no downtime. She's ready to face the world. No, it'll take about 3 months for Sally to see any results. That's about how long it takes the body to make collagen. That procedure costs anywhere from $1,500 to $4,000.
It gets rid of wrinkles and crow's feet. Now, Botox may put a smile on your face. A local doctor says he's found that Botox can erase the symptoms of depression in some people. Fox 5's Laura Evans joins us now with more on the Botox boost. Laura?
Yeah, Sean, this is interesting. Depression is one of the biggest killers of our time. Now some research is showing an unlikely drug may help lift patients from depression. And the discovery was made not by a psychiatrist, but rather a dermatologist.
Botox, a fountain of youth in a needle, is the fastest growing cosmetic procedure. Not only used to erase crow's feet, it's also used to treat excessive sweating, even migraines. And according to Dr. Eric Finzi, it may also be a cure for depression.
I think this could potentially turn out to be a fantastic way of augmenting what we currently have for depression.
Dr. Finzi, a dermatologist, has studied facial expressions for years, also happens to be an artist who paints facial expressions. Over the years, he has stumbled across several clues. Then his mom, depressed after his father died, developed a frown.
Things started just sort of clicking in my head. Gee, maybe that there's something going on here.
He thought get rid of the frown and lift the depression. So Dr. Finzi recruited depressed patients who'd never had Botox. None of them changed their medication.
I found that 9 out of 10 patients went from being seriously depressed to not depressed. And it was striking to me because some of these people had been depressed for 10 years. Continuously.
As a result of his findings, Dr. Finzi believes facial muscles may have more to do with our state of mind than we thought.
Even if you don't have a permanent frown, maybe you frown in your sleep when you're having a bad dream. Maybe you frown at different times during the day. Maybe this is all giving feedback to your brain.
Well, Dr. Finzi's findings were published in the latest Journal of Dermatologic Surgery. He's hoping the findings will lead to multiple studies on a larger level. Remember, Botox only lasts about 3 months, so patients would have to return that often for treatment. Sean.
Still fascinating findings. Laura, thank you. By the way, depression affects nearly 19 million American adults. That is 10% of the population.
We have a cosmetic breakthrough to tell you about tonight. Imagine losing fat and getting bigger breasts, all with a minimally invasive procedure. A local doctor says he has found the answer to breast augmentation without implants. Fox 5's Allison Seymour has more in tonight's On Call. Allison?
Well, Brian, body sculpting liposuction has become the rage by image-conscious women who want a balanced and proportional figure. Surprisingly, though, a new study says one kind, tumescent liposuction, causes an added benefit, a bigger bust.
Kristen Hancock has exercised,
and I can't get it flat.
and dieted,
I've lost 35 pounds with Weight Watchers.
A little dry.
but still can't get rid of the fat on her stomach.
I have a third child role
So she's seeing Dr. Eric Finzi for liposuction.
to define my body, make it look better.
Dr. Finzi will suck out Kristen's fat using a technique called tumescent liposuction, an increasingly popular method that's less invasive and requires only the use of local anesthesia.
Then once it's all numb, we'll make some couple of tiny little openings in her skin and then insert a little tiny tube in there, and then I basically sculpt the fat away.
Kristen's looking forward to a flatter stomach.
There goes those Krispy Kremes that I ate when I was pregnant with the first child.
But that's not all. Kristen's hoping her breast will grow after the procedure. Dr. Finzi says nearly half of his liposuction patients have encountered a very welcomed side effect, a bigger bust line.
I started noticing that in quite a few of my female patients, that 3 months after I'd done liposuction on their abdomen or their abdomen and flanks, they would come back in and I would take the post-op pictures and they would say, you know, I've had to change my bra size.
In a study he published in Dermatologic Surgery, Dr. Finzi found 43% of the women who got tumescent liposuction saw an increase in their breast size, often by 1 to 2 cup sizes.
But there are a couple of different possibilities. One is that when you remove fat, that fat was actually secreting some hormones which may have played a role in breast size.
Another simpler reason, the body stores a certain amount of fat, and by removing fat cells from one area, the cells in other areas grow. His discovery is so new, Dr. Finzi isn't ready to identify the perfect candidate for natural breast enlargement, but he says smaller-breasted women are seeing the best results.
From our home to your home, you've made the direct connection with Jeff Salkin.
Hello, everybody, and thanks for joining us. I'm Yolanda Vasquez. Jeff Salkin is off this week. Dr. Eric Finzi is with us here in the studio, and as always, you can join us by phone or email. Dr. Finzi, thank you so much for coming in.
Pleasure, Yolanda.
Liposuction, there's been a big buzz around here in the station talking about this. I was surprised to find out that there are at least or more than 500,000 procedures done each year. It's the #1 cosmetic procedure. Amazing.
It is. It is the most popular cosmetic procedure to date.
And how did it originate? Because I was reading somewhere in the late 70s in Europe.
In the late 70s in Europe and Italy, a surgeon came up with the idea and successfully performed the first liposuction. And that was the first major advance. People have been thinking about it for years, first major advance. And then about 15 years ago, the second major advance was the invention by a dermatologic surgeon of the tumescent local anesthesia. And that basically changed it from a procedure which was quite risky to one that's quite safe if properly performed.
Now we're going to go to an email that we have. I told you there was a buzz already, and prior to even starting the show tonight, we have an email from one of our viewers that says, how much fat can be taken out in a single treatment of liposuction? How often does the procedure cause complications? And that's from Jared in Baltimore City.
In terms of fat, there are actually some guidelines. The American Society of Dermatologic Surgery, as well as the American Academy of Dermatology, both have put out very safe, conservative guidelines, and it's about 5 liters of fat, which is a lot of fat.
That is a lot.
But that's still within the safe limits. There is something called mega liposuction, where people take out much more, and that's fraught with risk because the body really wasn't meant to lose that much weight suddenly.
Who are the best candidates for liposuction? I was surprised to read that there are probably a lot of people who are very physically fit who go in for this procedure.
The best candidates are people who diet, who do exercise, they walk, they try the best they can, but for genetic reasons, there's just a part of their body that's really out of sync with the rest of their body. Maybe it's the hips, maybe it's the stomach, maybe they've had 2 or 3 children, and since their pregnancy, they've just put weight on their stomach and they just cannot get rid of it post.